Good morning. I had a question today come to me on tendonitis of the elbow, and I wanted to reach out and give you a little bit more information about tendonitis and conservative care. Hello, I am Kim Narker, and I'm the owner and founder of Stretch Physical Therapy and Total Wellness. And I've just opened Stretch and Recover. It's a program full of recovery products for people who perform high-level intensity sports that need options for recovery. So, tendonitis in the arm and the elbow. Tendonitis is an overuse injury, and the tendon can become inflamed because of many reasons, and not knowing what the reason behind the injury is, I'm just going to speak on what happens when the tendon is inflamed, so that you can better understand aspects of tendonitis. So tendonitis, specifically in the elbow, is an inflammation of the tendon, and that tendon was put in an awkward position, or the muscle could have been strained. But what is happening behind the scenes, because our body are miraculous healing vessels, is that the actual tendon, because it's on a strain, is causing the joint to restrict and tighten. And in the form of your elbow, your hand is supposed to rotate. So with your elbow bent, let me see if I can get this in the picture a little better. If your elbow is here, your hand and palm should be able to be held up and down. So there's a rotational component in the elbow. Everything that you do at the wrist actually uses the top of the muscles that insert back here around the elbow to provide stabilization. And then here, when you're doing wrist flexion exercises, the other muscles come here and insert. At the elbow down here, you have a hinge joint that's sort of like an ice cream scoop that the bone is supposed to sit in there and roll this way so that you can extend your elbow and flex your elbow. So those joint structures, when you have an injury, actually get get a response to tighten. And when I say tighten, I mean the joints in those areas tighten. And it actually causes joints not only here to tighten, but there's typically some wrist and possibly some finger tightness too, because the muscles originate in one area and insert in another area. And then the muscles perform different actions for you. But because of the trauma and the inflammation in the actual tendon, those muscles are not going to be working correctly, and you're going to experience weakness in those areas. And then underlying, your body is trying to compensate for you to be able to do the things that you do. So for you to be able to use a mouse during the day, for you to be able to flat iron your hair, for you to be able to blow dry your hair, you use your wrist all day long, constantly flaring up that tendonitis. So, in order to get successful long-term relief that is natural, you need to go in and have grade 4 and grade 5 mobilizations done on not only the elbow, but also the wrist, but you don't want to neglect what's going on at the shoulder. Oftentimes, some of the problems here can be coming from the shoulder. So you want someone to look at that entire area to see what the joints are doing. You then want to look to see, have the muscles been affected, and has it started a process of weakness to occur? And if so, you don't only want to do exercise, because that won't fix the joint restriction. You want to go in and unrestrict the joint, then perform exercises that will refire the muscles, and there are a lot of muscles here. Once you've got those refired, tendonitis is just one of those little things that if you don't jump on really quick, it can become chronic, and chronic tendonitis can take years to actually heal. The premise is if you get in soon enough, you can get the pain to be relieved pretty fast. The longer you wait and the longer the inflammation occurs and joint restrictions, and we turn off these muscles and start compensation, then it could take up to 6 months for that tendon to heal and the muscles not to cause pain in that area. So before you go jumping on a bandwagon of injections or PRP or even a surgical procedure, please reach out to me and come in for an evaluation so I can tell you what is going on and show you where the joints are restricted, what muscles are effective, and put together a program for you that's not only cost effective, but will help you to avoid the trauma of injections, because you may not need those. So again, an initial evaluation is needed. We have to rule out to make sure that there are no underlying things that are red flags that could cause you not to seek conservative care. But the best line of defense to get that motion fully back and to get that pain away is deep thermal laser will heal it, joint mobilizations, refiring the muscles, and then returning the function in that body so that you can perform the activities that you have to perform on a daily basis. I hope this helps. If you should have any questions, please feel free to reach out to me anytime. 513-874-8800. Here's to a healthier you.